Good morning.
Hey, Kieran.
Morning. We'll get started in a minute.
Get in. There we go.
And if you could mute your lines, that would be great.
Kieran, I think the whole province knows who you are already.
Sadly.
And how to get a hold of you.
That's not stopping.
That's the bad part.
And Dennis, I didn't know if you wanted to say a few words to our staff or after I speak.
Whichever way you want, sir. I'd be glad to.
So with permission, I'll start first.
That's perfect.
Okay. And it's 9:01. So I just want to thank all the staff for coming on short notice at 9:01 on a Monday morning, May 31st. I first want to acknowledge that there's been news that has leaked and that it is correct that my name will be put forward to the legislature today at 1 o'clock. I'm sorry it's leaked early. I wanted to tell you first, and then there'll be a debate on Tuesday about my nomination and its potential that I will be nominated for the next Chief Medical Officer of Health of Ontario. I was approached directly by several of the leaders of Ontario, both the Minister of Health and the Premier, to take this job on. I did not seek it. It was asked of me, and I'm sure several other public health physicians across Ontario. It's a monumental task in a pandemic to take it on, but I agreed to have my name go forward out of a sense of duty to the province, out of a deep sense of responsibility, and with sadness. I am very proud of KFL&A. I'm very proud of working here and of all the staff. And it has been a highlight of my career to work here and work with each and every one of you. I just wanted to read off some of the stats that we're at today. We are down to 11 cases in KFL&A. We are down to 1.9 cases per 100,000. Our patients in hospital are doing better. We are 3 cases. 2 of them have, through the great work of the nurses and intensive care specialists, are starting to recover from COVID-19. We have one of the lowest rates of illness in the province. We also today have achieved 63.5% of our population over 16 being immunized. And if we're comparing apples to apples, the province uses the over 18 mark, and we're at 64.5% of our population immunized. We continue to have great testing in our community, and 0.13 of the tests right now in our community are being positive. This is the lowest rate of illness that we've had since November of 2020. So, our community and through our agency has done tremendous work in a pandemic to limit the effects of this virus on our community and minimize the impact of the virus on our healthcare system. Sadly, there still is the mental, social, physical, and economic ramifications of the pandemic, and we will get through it. And we will begin to restore our key functions in public health to continue to protect our community, to protect the food people eat, the water they drink, the air they breathe, and to continue to do the great work to support families and mothers and children in our community. And work on other major health issues. So we will begin to restore our core functions over the coming year and to rebuild. And the reason I took this job, and hopefully it'll be approved, is to help Ontario rebuild, restore, and recover from this pandemic. It's a monumental task, but I've had 35 years of experience in the healthcare system. And when the Premier phoned me, I accepted. But I leave KFL&A deeply proud of each and every one of you. And I promise I will stay in touch and I will stay committed to this community, and I will stay living in this community. So you won't, you'll be seeing my face hopefully in this building, and I will be commuting to Toronto and staying connected to our residency program, our training, and Queen's University as well. So I hope you're hearing from my voice. It was a difficult decision. We will ensure that KFL&A remains one of the leading public health agencies in the province. I will help the board with their decisions to choose the next medical officer of health, and I will support that individual from the chief medical officer of health vantage point. And our residents will continue to work here to learn from each and every one of you. I can't tell you how proud I am and how well you have all done living and breathing our values and supporting our community. Change is a constant in life, and we all have been used to change over the last year. I have an attention deficit disorder. Being an emerge physician, like challenges, and I hope you'll support me as I move to this new position, hopefully approved by legislature tomorrow as the new chief medical officer of health. It will be a challenge. We have to build back better. We have to build Public Health Ontario once again. We have to build the structure of the chief medical officer of health. And I want to assure you that public health has to remain as a core service that's driven and integrated at a community level, and that this government will not make any quick decisions on changing the structure of public health. We need to recover, we need to restore, we need to rebuild and build public health back better over the next several years. And I've had the discussions with the Premier and the Cabinet and the Deputy Minister, and they've heard me loud and clear. So with that, I'll say thank you. I will be transitioning over this week. I'll be meeting with our senior leadership at 10. This decision kept upon us very quickly as Dr. Williams decided to retire. He had holiday time coming to him, which was well deserved. And he will be leaving the office on June 26th. So as a result, they've asked me to spend time with him and with his leadership team and help in that transition as I learn the requirements of the position at a provincial level. So from my heart, I want to thank you for all you've done and continue to do. And I will stay connected with you. Thank you. And Dennis, if you wanted to say a few words, and then I can take any questions from staff if you'd like.
Yes, thanks very much, Kieran. I just want to say that we had hoped to have a formal meeting this morning to advise before the press leaked it, but that wasn't possible. So thanks everybody for taking time at 9 o'clock in the morning to hear our message. But certainly we're, as a board, very proud of Kieran, and we want to thank him very much for taking this assignment. I know it would have been a lot easier to finish out your career here in Kingston, where you do have the best staff in Ontario as far as all the 34 health units. I know that you're up for the challenge and that you'll do us all proud going forward. We will have a press release coming out later this morning, and we do have some very solid backup plans. As I said, we got excellent staff, so the board is not worried about the transition, and we do know that Kieran will be there to support us should we have any difficulties, but I'm sure that we're going to try to do it on our own, and we've got capable people to help us through, and we will be posting for the job probably over the next month or so, but we don't expect that we can find the best possible MOH quickly. So it would probably take the summer months, and we will get through this together. And I want to thank everybody, all staff and the board, for the support, and especially Kieran for his leadership over the last 4 years. And I think it was 7 years before that as the AMOH. So we will miss you, but we'll be in contact. Thanks, everybody, and have a good day. And as Kieran said, it's open for questions. Don't be shy, folks. Any questions from the board or staff?
Well, I just want to let you know, I'll be around in the building and walking the floors, and happy to take any questions on a personal level. And also hopefully back on Fridays here at KFL&A as part of the residency program, and working in a cubicle like I used to do at the beginning of my career here at KFL&A. I used to have a little office in a cubicle in the library when I started the syndromic surveillance system. I'm happy to have a little cubicle there and stay in touch with everyone here. I'm so proud of every one of you, and it's been an honor to serve and an honor to work with this board. I will ensure that we stay in touch over time.
I think Kathleen has a question. I see a hand up.
That was a mistake. I apologize.
Well, that's okay. Good morning, Kathleen.
Good morning.
And Kieran, I'm sure the board will be glad to find you a space to sit at, and a telephone or whatever you need, internet connection, if you want to work out of our building. I presume you'll be buying lots of Via Rail passes and traveling the rails a few times a week.
And yeah, and well, Julia is asking if I'm going to bring the flip chart. So yes, I will have to carry this the flip chart with me.
There must be a foldable, portable flip chart you can bring along on the train.
And when this is over, I promised to have a social event, and I will attend, and we'll celebrate this together. But today is also a celebration day, given the rates of illness in our community, and that is due to all of your hard work and due diligence. And our immunization team and all our volunteers are just amazing, and we will celebrate. So thanks again.
Well, we'll hold you to that. That's probably September timeframe, though.
One hopes.
Well, let's hope it's that soon. Yes.
Bye for now, then. And again, I'll be walking the building and saying hello to all the staff, and very approachable for any questions.
Well, thank you, sir. And again, we'll miss you, but all Ontario will gain from your expertise and your hard, diligent work. Thanks again. Bye-bye.
Bye-bye.